Hello, my name is Dr. Cheryl Burdette, and I am the Educational Director for Origins Incubator. Today in our clinical class, we talked about how you really dig into that more complicated patient. How do you weave through the world in which there are so many lab results out there to be considered? We have to consider finances. We have to put a realistic plan together for the patient. So we talked about Lyme disease in particular, and we looked at the fact that it is this whole multi-systems infectious disease syndrome. And so not only is there the Lyme to deal with, but there are all these other bugs and a compromised immune system, which leads to neurologic damage and mitochondrial damage and hormone issues. And so where do we start with this? Then, in addition to that, very intimidating types of infections like Lyme disease, like Bartonella, like mycoplasms. And so how do we manage all of this web of chronic disease that can be based in various infections? And so we talked about how even in a scenario like that, it is still absolutely necessary to build the person. And this is why we tend to do better with infectious disease and a functional medicine approach, because we're not just trying to hammer the bug, but we're building the person at the same time. And so we broke it down. We talked about, what bug is it that we're addressing? Here are the tests that we can use to understand that. Now, once we know the bug, here are the botanicals that do the best with that. Here are the biofilm considerations, and here are the immune system considerations. And then we talked about how in that paradigm of first building the patient, that we're going to need to stick to our basics. We're going to do that foundational assessment. And then from there, we're going to think about, okay, what is Lyme disease doing? It's causing more neurologic damage. So how do we improve the tissue? How do we increase the integrity of something like the myelin sheath? We know it's a mitochondrial disorder. So what are our go-tos there for mitochondria? We know that hormonally speaking, that the adrenals is an area that are likely to be worn out by the stress of a chronic infection, and that the rest of our hormones can kind of take a break too when they see that we're under this much stress. So looking at hormone levels as a piece to understand next steps. And then when we break it down into these digestible bits and we think about which of those areas are most applicable to the patient, it's no longer this overwhelming world, this web that's impossible to navigate. We begin to have a stepwise approach. We begin to see how the puzzle pieces fit together, and we know how to take something that's very complicated and move it into actionable steps, not only in terms of how we are thinking about it, but also so that the patient can manage it.